Hello guys, welcome to my YouTube channel. Today we will be discussing about the pathogenesis of gallstone formation. So basically there are two types of gallstone. One is cholesterol gallstone and another one that is bilirubin gallstone or pigmented gallstones. So today we will be discussing about the pathogenesis of cholesterol gallstone. Okay. So here you have to know there are four things, that is cholesterol supersaturation, gallbladder hypomobility, nucleation and precipitation of the cholesterol monohydrate crystals, and growth to stone sized aggregates. So at first there is cholesterol supersaturation. Okay, so normally you have to know that the hepatocyte, they secretes the cholesterol into vesicle form. This vesicle may be unilamellar or multilamellar. Unilamellar means the cholesterol that is surrounded by one layer of phospholipid. Okay, and multilamellar means there is more layer of phospholipid, more than one layer of phospholipids. Okay, now the next process, that is micellation. What does it mean? It is the process of conversion of the vesicle into the complex aggregate of water soluble molecules, that is known as mixed micelles, right? And this is done by the detergent like action of the bile acid. Now what happens? Mixed micelle, that means there are three part. Okay, one is the phospholipid, one is the cholesterol, and another one, that is the bile acid. So the hydrophobic part of this three component becomes aggregate and they are present in the center, and the hydrophilic part is present at the periphery. They are oriented at the periphery. Okay, so this orientation makes them soluble in makes them water soluble. Okay, so the next one, that is a supersaturation. So what does it mean? Supersaturation means it's a condition where the concentration of the cholesterol exceeds the solubilizing capacity of the bile. Okay, so it is one of the most important mechanism in the formation of lithogenic bile. Now the cause of supersaturation, why there is supersaturation? Either there is more secretion of the cholesterol, or there is decreased bile acid formation. Now when there is increased biliary cholesterol synthesis, look, there is increased biliary cholesterol synthesis when there is a high, when we take high calorie diet, high cholesterol rich diet, some kinds of drugs like clofibrate. That particular clofibrate is a blood cholesterol lowering agent, right? So they tends to do what that they excrete the cholesterol more into the blood, into the bile. All right, so that is why there is increased cholesterol secretion. Or in case of pregnancy, what happens in pregnancy, in the last trimester there is high amount of progesterone in the blood. So that progesterone causes that prevents the gallbladder to empty the bile from the gallbladder, right? So there is gallbladder stasis. In case of OCP does what? It increase the uptake and synthesis of cholesterol, right? So these are the causes of increased biliary cholesterol production. And there is decreased bile acid. Why bile acid is important? There are two components which are here important for the solubilizing the cholesterol. One is bile acid, another is phospholipid. Now when there is Crohn's disease, as you know, in case of Crohn's disease the terminal ileum is affected. Okay, so the terminal ileum is affected, and that is why there is not enough uptake of the bile acid from the terminal ileum, and there is decreased bile acid, and ultimately leads to the cholesterol supersaturation, right? So the next part, that is gallbladder hypomobility. Normally what happens, the gallbladder empties completely the bile, okay, into the duct. So there is um, it excretes its bile along with all the supersaturated bile or crystals, right? Now, in case of abnormality like gallbladder hypomotility, it causes the gallbladder stasis, and when there is gallbladder stasis, it promotes the aggregation of the cholesterol, right? So there is ultimately biliary sludge formation because of that. And now the third part, that is nucleation and precipitation of the cholesterol monohydrate crystals. So what does it mean by nucleation? Look, what happens when there is increased cholesterol and there is cholesterol saturation, cholesterol cannot be solubilized, so cholesterol becomes it in its primitive form, in its unilamellar vesicle form. So there is increase in the unilamellar vesicle within the bile. Ultimately, that unilamellar vesicles fuse and form multilamellar vesicles. Now these multilamellar vesicles, what it does, they becomes nucleate to form solid microscopic uh, cholesterol monohydrate crystals, right? So this nucleation is a crucial step for the formation of the gallstone. Now there is sometimes accelerated nucleation. Okay, the speed of nucleation increased. It may possible because of either there is increase pro-nucleating factor or deficiency of anti-nucleating factor. So in case of increase the pro-nucleating factor, the pro-nucleating factors are like there are mucin and non-mucin glycoproteins present in the bile, so they are pro-nucleating factor. What they do, they trap the cholesterol crystals, cholesterol monohydrate crystals, and they promote the aggregation of cholesterol crystallization. Okay, and the calcium salts like calcium bilirubinate, calcium phosphate, okay, these are also serves as the pro-nucleating factor. Now anti-nucleating factors include like apolipoprotein A1, A2, and some glycoproteins and phospholipids, etc. Okay, and the last, that is the growth to stone sized aggregates. That means ultimately there is stone formation. Okay, so what is that is the first one, that is biliary sludge. What is sludge? Biliary sludge means it is a suspension. Okay, it is a suspension of the precipitates of the cholesterol monohydrate crystals, right? It may be the cholesterol monohydrate crystals or the calcium bilirubinate granules. Okay, so ultimately biliary sludge can resolve or persist and progress. Okay, so when it progresses to stone, its crystals grow to form plates, in part because of the impairment of the gallbladder contractility. Now next one is microlithiasis. That means the microstone formation. So previously there is, up to the formation of biliary sludge, there is already formed the crystal cholesterol monohydrate crystals. Now they becomes to adhere and form microstones, and ultimately gallstone formation by addition to that microstone the cholesterol and the different components, right? So this is about the pathogenesis of gallstone. Thank you guys for watching and listening this video.